So again, it comes down to the specific individual. If you're dealing with an athlete who's trying to gain power and speed, we're going to take some of these external loads or some of these movement patterns and try to be as forceful as possible. So you think of a multi-joint, multi-plane exercise like the snatch, the clean, the sled push, things like that. We're going to try to build as much power and speed as possible. If you're looking at someone who is trying to build aesthetics or someone who is generally trying to get stronger, we don't really want to go through speed patterns or anything that's going to necessarily benefit fast twitch muscle fibers. We're going to be looking at building as much strength and stability through the muscles through slow controlled movement. So it comes down to specificity of the program and what that person, what that individual needs or wants to get out of their program.
Hi, everyone. This is Vital Discourse, and today we're going to be talking in general about fitness. There's been a lot of talk about the decline of American health since the 1970s and 80s. Unfortunately, Lee and I both remember growing up in that time. In general, we're more obese in America. We have more chronic disease, and for the third year in a row, our average lifespan is decreasing, not increasing, and that's very different from the developed world. Some of this can be traced to our poor diets and a toxin-heavy environment. We all know that. We'll tackle those in another episode. But in general, fitness, activity, and movement are an essential part of anyone's healthy lifestyle. And Dr. Lee has a very special guest on today that's going to help us talk about that. Lee?
So I'm honored and delighted to introduce my good friend and personal trainer, Brandon Ward. Brandon is a former Division I collegiate athlete who spent the last 18 years bridging the gap between high-performance athletics and everyday health. He holds a master's degree in injury biomechanics and exercise physiology, making him a go-to resource for training that is both effective and safe. As a certified strength and conditioning specialist and level 2 nutrition coach, he doesn't just guess. He knows. He's currently a gym owner and health coach dedicated to helping people build stronger, resilient bodies. And if you happen to live in South Florida, the name of Brandon's gym is the Ludus, which is located in Weston, Florida. The college football playoffs are ongoing, and we've got our last two teams. So we'll talk a little bit about the teams. Brandon went to Florida State University. Most of you probably know by now I went to University of Florida. And Ben, where did you go?
I'm a big fan of University of Miami. I grew up in Miami, so I didn't go there, but I'm a Hurricanes fan from way back.
Yeah.
From the Coach Snellenberger days.
Yeah. Didn't hear a bit about the Hurricanes when they were losing their Ben.
We were rebuilding. That's what it's known as. And now we're back.
So Brandon, the name of your gym, the Ludus. Tell us how you arrived at that name.
So our gym is called the Ludus, and it refers to the ancient Roman times. Back then, it's where the gladiators and people around the fitness industry, or not fitness industry, but people around the gladiators would teach everyone, how to eat, nutrition, working out, fitness, and general health and lifestyle. And so our goal here at the Ludus is to make sure that we're not just getting people a good workout, but teaching them the healthy lifestyle and habits that will continue to foster longevity in their life.
Yeah, and if anyone ever has a chance, if you happen to be in Sunrise, Florida, if you know South Florida, Sunrise, Florida is basically western Broward County. If you're able to stop by Brandon's gym, it is one of the coolest places I've ever seen. Great place, amazing place to work out, and Brandon is top notch.
I got to stop by there next time I'm visiting, Lee.
Yeah, absolutely. You'll train with me.
Yeah, for sure.
I would love to.
That'd be great.
I train, as you know, I train pretty much 5 to 6 days a week.
So Brandon, tell me, when someone comes to the gym, we'll go through the different types of people that come to the gym. So first, for our listeners and followers out there that might be kind of occasional gym rats or work out a little bit here and there, do it on their own, don't do personal training, that type of thing. Number one, how do you assess what to do? Number two, how do you implement it?
Okay, so number one is going to typically be a sit-down interview, getting a feel for that person and what they're looking for. Oftentimes, people come to the gym with a want that's either tied to a health-related issue, so some kind of health event happened, be it a tests that came back negative, or with some red flags, or a doctor or someone in their family has had a health event. Or other times it's going to be an aesthetic based thing. So someone wants to look better. Those are two generally the main reasons people start at the gym. From that interview process, though, as a trainer and as a actual like fitness professional, our goal is to try to figure out not necessarily just what someone wants, but also what they need. So there are a couple of different pillars of fitness, be it cardiometabolic, strength training, mobility, and nutrition, and trying to figure out where in their lifestyle they're having a lack and where we can fill that need and that gap and teach them the things of the pillars that they need to move forward. From there, it's going to go into a physical assessment. That physical assessment typically is going to go through biomechanical analysis. So looking at gait, looking at posture, looking at flexibility and mobility in different ranges of motion, and then looking at strength in different specific ranges of motion, in different planes of motion. And then from there, we kind of build out a strength and conditioning protocol as well as cardiometabolic protocol to get that person to their goals and meet their needs at the same time.
So first of all, what's the most common type of training mistake that people are making when they come to see you?
Typically, when they're coming to see us, the most common thing that they are having an issue with, I would say, is no program. Programming is kind of the most important thing, because when you go to the gym on your own or you don't know what you're doing, you typically just go and run through the same exercises randomly, ad nauseum, because those are the things you've always done. And that's going to be typically the biggest hindrance to progression. Also, another thing people do is they latch on to trends too quickly. And so one week the trend may be high volume, the next week the trend may be super heavy, or just glute based, single exercise, single joint movements. So latching on the trends ends up causing people to change their programming too quickly without seeing results as well. So everything we do in the gym is typically related to trying to find what someone needs, what someone wants, building out a program, and strategically working towards building those gains over time before we change the program.
So there's a lot that people discuss and you read on the internet all the time: cardio versus weight training versus weight training using weights, actual weights, versus weight training using just your body weight. Tell us how you figure out what to do more of, less of. What do you do first? What do you do second? How does this progress?
Okay, so they're all great, and they all have their role in a fitness program. It really depends on what that person's trying to achieve and where they are in their fitness journey. Typically younger individuals, so we're going to talk about adolescents, teenagers, people new to fitness, are going to stick in that body weight range in terms of strength training before we progress them to external loads, or people who are elderly or haven't really, again, in their adult life, used very many weights.
Brandon, what's behind that? Why do you choose to do that with younger folks? Is there a particular reason?
Well, it's really trying to get that neuromuscular adaptation. There's no need to add an external load to something that you can't do with your own body weight, right? So if you're going to do a squat or a step up or a lunge, and you're not very stable, don't have very great control of your mechanics with just your body weight, adding an external load is going to be potential for an injurious event. And so just from a standpoint of teaching someone how to move their body, how to be aware of their space and trying to activate the right muscles, body weight is where we're going to start first.
It has nothing to do with growth rate or how their bones and joints are going to handle it. What's the earliest that you start somebody working out?
So in the past, when I was in graduate school, the research used to say that, or the popular opinion was that we wouldn't start any external loads with someone until they reached puberty, right? Until they were teenagers. But some of the data and research that's come out recently in the last 5 to 7 years has shown that you can start external loads as young as 7. I personally haven't seen that because there are very few 7-year-olds that can control their body in a way in which, that they could do some of these things. But you have seen some individuals who have been doing body weight training as young as 3, 4, 5, 6 years old, can get to some external loads with moderation.
Okay, great, thanks.
And so, is there's the load, right? And there's the building up of the muscle. How about in terms of speed of the activity? How does that play a role in terms of how fast they're doing the actual action? Slow twitch versus fast twitch muscle fibers and that type of thing.
So again, it comes down to the specific individual. If you're dealing with an athlete who's trying to gain power and speed, we're going to take some of these external loads or some of these movement patterns and try to be as forceful as possible. So you think of a multi-joint, multi-plane exercise like the snatch, the clean, the sled push, things like that. We're going to try to build as much power and speed as possible. You can even take single plane exercises like the squat or the bench press and add some speed factor to them using bands or chains and things like that. That's going to help produce power and create more strength in those fast twitch muscle fibers. However, if you have someone who is looking just generally to be fit for longevity and health, that's something that we can do at higher levels, but isn't necessarily relevant to their lifestyle or circumstance. If you're looking at someone who is trying to build aesthetics or someone who is generally trying to get stronger, we don't really want to go through speed patterns or anything that's going to necessarily benefit fast twitch muscle fibers. We're going to be looking at building as much strength and stability through the muscles through slow controlled movement. So again, it comes down to specificity of the program and what that person, what that individual needs or wants to get out of their programming.
We see a lot of people that are dealing with different types of injuries, people, whether it's acute injury, whether it's chronic injury, as we get older, knee issues, hip issues, those types of things. And it would seem to me, at least as a physician, because I see so many of these people coming through my office and telling me about these other largely orthopedic musculoskeletal issues that they're dealing with, that most physicians are sending patients to physical therapy, and then that's it. And they're not directing patients with these either acute or chronic injuries to someone like you. If those people came to you, what could you do differently than physical therapy could do?
A great question. So typically physical therapy is going to look to get someone back ambulatory, right? Are you able to do tasks of daily living without assistance? So can you put on your clothes? Can you use the bathroom? Can you get up and down out of a chair? Simple things like that. What my focus would be in that regard would be corrective exercise into then longevity-based exercise. So that corrective exercise is going to look at that either acute, if it was a non-contact injury, or the chronic injury that occurred and what caused it. Typically, that's going to be an imbalance or be it in strength or lack of mobility, flexibility in different limbs and different muscles. And we try to attack that, right? We try to make that, take away that imbalance and make things more balanced and symmetrical. And then we try to progress in terms of strength to make sure that individual is able to not just do things, activities of daily living, but really thrive. And so building that strength helps with longevity long term.
Yeah, and I think speaking from my own issues, because I used to have significant knee issues, and I can tell you that the one thing that Brandon taught me was the idea of complementary muscles. For example, anterior chain versus posterior chain in the lower extremity. You tend to find that people are either working one side of the leg or the other side of the leg, but not both sides of the leg, right? And so the muscles around the joint, instead of working in a complementary fashion, you have an overload on one side and a weakness on the other side, and that actually makes the condition worse as opposed to better. There was a time when I had difficulty literally walking down the stairs because I had such significant knee pain, and with Brandon, working both sides of the joint, what a difference! I mean, I have literally, knock on wood, no knee pain at all.
We typically see that with chronic injuries. People tend to avoid what's going on. They'll go to their orthopedic and they'll get a diagnosis. If it's something structural, like you have a meniscus tear or some kind of ligament injury, then we need to address that first. We need to address the structure. But outside of that, it's typically people having a lack of stability, a lack of strength in the muscles surrounding that joint. And oftentimes people avoid that because of the discomfort. But the real goal is to, one, understand exactly which muscles the imbalance is coming from and try to attack them and build them up so that they can provide the stability that you need to achieve those, movement patterns of daily living, like walking up and down stairs and getting up and out of chairs.
Brandon, do you do high intensity interval training as part of your project with folks, depending on what their goals are?
Yeah, if it's the right population, for sure.
How do you do it?
So high intensity interval training it can take the form of many different shapes. So it can be as simple as doing a Tabata, right? Tabata is going to be any movement pattern, mountain climbers, squats, lunges, etc., for a period of time, typically about 40 seconds with about 20 seconds rest over 8 rounds, right? That's going to attack that cardiometabolic system. Another thing is it can take the shape of any movement pattern you want: jumping jacks, ski erg, rower, echo bike, etc. But it's going to be short bursts, so short duration, anywhere from 10 to 40 seconds of activity at about 80% to maximal exertion, with a period of time of recovery, and then repeating those bouts.
Do you have that set up at your gym? Can you do that at your gym?
Oh yeah. Lee sees that often enough. We get
Lee,
on
has
that,
he got
on that
you
row
running
machine,
around
that
doing burpees or something?
No burpees.
No burpees, no burpees for me. But actually, my son also trains with Brandon, and some of the stuff he has my son doing with the weighted rucksack, and it's just some really crazy stuff. But that.
Yeah, I was going to say that because we did that in the Marine Corps many years ago. I mean, I was a Marine from '88 to '93, and we did a lot of high intensity interval training. They called it fartlek training. Where we would have staged venues throughout the woods on a 5-mile track about every half mile apart. So you would sprint a half mile, you would be at this station, you had to do something. Some of them were actually rings where you had to engage in fighting with somebody who was coming the other way. So when you were doing your first one, they were doing their last of the 5 miles. And when you were doing your last one of the 5 miles, you were meeting someone who was fresh. And I remembered that because that was the best shape of my life. And I didn't know if that was still sort of a thing. I know that there's a lot of great data that it shows that you lose weight faster and you build muscle more. But I didn't know if it was incorporated into these new gym profiles that you made up for people.
Yeah, so one cool thing is that fartlek training minus the in-ring fighting and things like that is a good way for people to train for longer distance running. So if you ever have a friend or family member who's getting ready for a 5K, 10K, half marathon, there's actually a training protocol named fartlek for that running and cardiometabolic training protocol. Going back to Lee and his son, Lee's kind of real modest, but he's in really, really good shape. I mean, his son came in one day and was doing muscle ups and L sits and all kinds of things, things that I don't have Lee do. And Lee was like, you know what, let me try that. And he was able to keep up with his son, which was without ever having any cueing or ever working those muscle groups in any specific fashion. So that was really, really impressive. But here at the gym,
that's impressive.
I wanted to just make sure everyone knows that guy is in really good shape. Outside of that, here at the gym, we do a lot of high intensity interval training. When you speak specifically to weight loss or fitness in general, high intensity interval training leads to greater weight loss or more efficient weight loss because it actually helps with EPOC, exercise post oxygen consumption. So when you're doing the exercise, when you're doing the bout of high intensity interval, you're going to be getting up to 80 to 100% of your VO2 max, right? You're going to really push that heart rate as high as possible. That creates an oxygen debt that is then repaid after you're done exercising. So even though you've come back down to homeostasis, you're at home, you've taken a shower, you're sitting on the computer, etc., your body is really, really trying to work to pay back that debt. Your cells, your mitochondria, and those kind of things are still burning calories, even though you're at rest. And that's what leads to the greater cardiometabolic effect and then eventually weight loss.
That's what gives it that buzz afterwards that you have for a few hours. Yeah.
So, Brandon, some people might not understand some of the terminology. So tell us what VO2 max is. Tell us what you mean by homeostasis, those types of terminology a lot of people might not know.
The homeostasis is your body just wanting to be at its normal resting heart rate, resting blood pressure, kind of that status that you're typically in when you're sleeping or when you're resting. VO2 max is the actual measure of your cardiovascular fitness. And so you can do that in a lab setting and with a VO2 max testing or sub-max testing. But now we have so much technology around that we can estimate your VO2 max based on heart rate and exertion during exercise. And so there's a fancy formula that you can use to calculate your VO2 max. But typically, if you have an Apple Watch or you have a Whoop or a Garmin or one of these things, it can estimate your VO2 max. And the higher your VO2 max is, the better your cardiovascular, cardiometabolic fitness is. So if you look at some of the high level athletes, you're talking about like your Lance Armstrongs, your Michael Phelps, your LeBron James, they have pretty high VO2 maxes, but also those VO2 maxes are specified to their activity. So, for instance, if you were to take Lance Armstrong, whose VO2 max is really, really high and his heart rate probably stays really, really low when he's on a cycle, if you were to translate that and have him go and, play a football game or a basketball game, that cardiometabolic fitness might not translate. So sometimes it is fairly specific, but you do see some carryover depending on the activity.
Interesting.
That's really neat stuff. Do you do any type of body composition analysis as part of your training?
Yes. So typically in our first assessment, as a part of that biomechanical assessment, we do a body composition analysis on the in-body machine. So that looks to tell us not just what your body weight is, but what your muscle mass is, what your fat mass is, what your hydration levels are, where that muscle and fat lies in your body. Are there any discrepancies bilaterally? Where that visceral body fat is, and then it gives us an understanding of what your BMR is, your basal metabolic rate. So we kind of understand exactly how many calories you need to maintain your current body composition, and that way we can give some detailed guidance into nutrition in terms of macros and how to adjust and change your body composition for the better.
And are there specific guidelines that you put those numbers into, I guess, based on someone's age or their fitness level or whatnot?
Yeah, so the body composition is going to be age and gender matched. Then from there, when we go into the nutrition and talking about those things, it's really tied to their health and aesthetic goals. If someone's coming in and they're dealing with high levels of body fat, or they're dealing with low levels of muscle, or they really want to make a large body composition change, let's say someone's trying to lean out in a very, very specific manner, that's where we go into the specifics of the nutrition and trying to break down those macronutrients to get them to the ideal body composition for their desired goal.
Brandon, before you do that, do you ever have them engage a blood draw, try to understand where their hormonal makeup is at that moment? Do you ever look at their labs?
Ideally, it depends on the person. I personally have a couple of different clients who are physicians or that will refer their patients to me. And so that's an easier entryway into their labs. Or if someone has a health event, right? Someone's coming because they have high cholesterol or they have hypertension or they just found out they're pre-diabetic, et cetera. That's another entryway into talking about their labs. But I found that if someone's not coming in with that health specific, want, it can be a little intrusive in the fitness space to say, hey, I need to take a look at your labs before we start this. I will suggest it oftentimes. Most people take me up on it, take our trainers up on it. But you do have some people who don't want to go down that rabbit hole.
More and more people are, I have a wellness center here in Houston, Texas. And before I start manipulating somebody's diet and exercise patterns, I always try to get a picture of what it looks like inside their body at that time. And so one of the things that we look at is their hormonal states, and that's everything. All their nutritional aspect is laid out on their labs as well. So we look at their vitamin D3, we look at their vitamin C, we look at their testosterone, their growth hormone, their thyroid hormone. We look at everything like that just to get a picture of what we're dealing with. I know that you don't have anybody go through peptide manipulation, do you?
No, not with.
Do you work with peptides at all?
We have some peptides associated with the gym, but we don't work with those things unless someone is directly working with a physician. And again, it's one of those things where ideally the best case scenario is to get an understanding of what someone's coming in with in terms of their labs, and then we can have a very detailed discussion on how we can change things. And that's where you see the most and best results for people is if they're coming in with that understanding that all of this is holistic and it's all tied together. You can't have one pillar without the other. And yes, you may want to look great, or yes, you may want to drop X amount of weight, but if you don't understand what's going on inside of your body and where we're starting from, we're really just kind of taking shots in the dark. The idea is to have a very detailed goal and very detailed plan and program, and kind of execute as we go along and taking measurements the entire way.
Awesome.
So, Brandon, I want to circle back around here. We were talking earlier about high intensity interval training, and that's become a very, very popular way to for people to get their exercise. We see things like Orange Theory. We see things like what is it, F45 or something like that.
Mhm.
Yeah, those different places opening up. Explain the difference between coming to someone like you and doing those types of things. Explain why someone should or shouldn't go that route.
What's the injury rate on that?
Yeah, what's the injury rate? What are the pros and cons?
So the biggest difference is going to be specificity. When you're joining a large group class like an Orange Theory or F45 or CrossFit or something like that, typically everyone's doing the same workout and it's not programmed. It's going to be Monday is whatever they decide to do that day, and it's going to change every single Monday. There's no progression in that plan. So that would be the biggest difference. You're not really going to get significantly stronger with any measurable intent. You may lose some body weight, you may drop some body fat, but it is really just a stab in the dark. You're really just throwing.
So it's a motivation thing, being part of a group more than like being held accountable and doing it.
That's typically why it's a lower barrier of entry. Yeah, it's a lower barrier of entry for someone who's not into fitness or not into exercise in general. It can be a little daunting. It can be a little intimidating to come see a person and a specific individual and have to be accountable to that one person all the time. Whereas if you can join a group and you could be one of many, if you don't show up that day, if you don't put yourself that hard, no one really notices, right? But you can check the box and say that you did it. So for someone who doesn't exercise very often, it can be something that at least gets them moving in the short term, right? But I wouldn't say that should be anyone's be all end all to fitness and their entire programming. Ideally, someone has some professional that's giving them some guidance in the specificity of what they need for their goals. And if you use Orange Theory or use a group class to make sure you're able to get that fitness in when you're not with your trainer or when you're not with your strength and conditioning coach, then that's fine. That way you can make sure you're getting some level of movement every single day. But ideally, someone's going to work with someone who's going to help them get to their specific goals.
And I can tell you, I have some experience with this because I've done those types of classes, and I've had some level of professional training in terms of fitness for the last 40 years. So I do have an understanding of body mechanics and body positioning during certain types of movements. And I can tell you that when you have one or two people running a class of 20, 30 people, there's almost no, at least in my view, there was almost no attention to the details of the individual person. And there were people that were doing exercises where if they kept doing it, they're going to get injured. So it's interesting you said low injury potential. I think perhaps there's a higher injury potential in some of those types of classes.
There's a higher injury potential. I meant not lower injury potential. I meant lower barrier of entry to exercise. So like someone who does
entry. Sorry.
There's definitely a higher injury potential because typically people, one, aren't learning in those classes. So say the class involves a circuit of 7 or 8 exercises, right? And those 7 or 8 exercises can be as simple as a bicep curl. They can be as intricate as a single arm muscle snatch, right? And all of those exercises will be on that board or whatever the workout is for that day. And someone could be their first day coming into the class. You can have someone on their second week in the class, and you have someone who's been doing the class for 6 months. And they're all in that same class. And typically, if you only have one instructor, they really can't bounce around to make sure that everyone's doing the exact movement pattern correctly. And the person who's on their first day is at a potential for injury, but also the person who's on that 6 month is on a potential for injury for that movement pattern. And that would be the biggest issue with those classes. Now, I don't want to say there's something that no one should ever do. Like I said, if it's something that's going to allow you to get moving as opposed to just sitting on the couch, by all means, start there. But it shouldn't be the foundation of your program.
So, Brandon, with that and said, though, how important is recovery when you're building a program for somebody? I mean, in other words, so you told me earlier that that Lee works out 2 days a week with you, and I'm sure Lee does something on those other days. But how do you build a program for a average guy coming into you in terms of recovery? How many days a week are you training, and what do you talk to them about in the recovery when they're not with you?
Well, recovery is going to be the name of the game. So when you're here at the gym, you're really just breaking down muscle tissue, right? You're really tearing that muscle tissue, trying to build that strength. And the recovery is where those muscles regrow, get stronger, or where the changes typically happen. And so a lot of our teaching.
So it's the other part of the workout.
Yeah, it's the more part. Exactly. So what we try to teach people, one, is all the important steps in recovery, but two, to be accountable and intentional with their recovery. So here at the Ludus, we have an entire recovery suite. We have cold plunge, sauna, massage chairs, Normatec boots, red light therapy, etc. Ideally, someone here at the Ludus would come to the Ludus every day, regardless if they're training or not, and use that recovery suite and making sure that they're getting the adequate sleep and nutrition necessary to get the gains that they're looking for. If they're not able to come in on a consistent basis, then we're typically talking about that recovery and being intentional about it and telling them exactly what to do on how many days.
So sleep and nutrition, that's right up our alley. We talk about sleep all the time because we are sleep and snoring experts. And so absolutely important in terms of your growth hormone release at midnight to 4 a.m. And but the cold plunge, tell us about that. So you have a cold plunge right there. I know you watch all these people doing cold plunges for longevity and things like that, but it's part of the recovery, and you guys have it right in the gym.
Yes, it's definitely part of the recovery. For the cold plunge, I wouldn't do it directly after a bout of exercise because it's going to inhibit that muscle growth and things like that. But on a separate bout, be it hours later or a day in between, that cold plunge is going to help get rid of some of that lactic acid. It's going to reduce some of the soreness that you have going on, reduce inflammation. So cold plunge is definitely a part of the therapy for sure.
Interesting. And you said the red light therapy, that part of like a red light sauna?
We have a dry heat sauna that we add red light to. We also have individual red light therapy outside of the sauna as well. So that red light therapy is going to be good for cellular health and other things, circulation, etc.
So you don't recommend working out every day for most folks. You recommend a cycle throughout the week that involves an active recovery.
Yeah, and that cycle is going to be dependent upon the goals and the time horizon of those goals. So if you're an athlete or someone who's trying to run a half marathon in X amount of time, right, we're going to build a program to get you to that time horizon. However, if you're just looking for longevity and health, it's going to be about how many days per week can you actually get to the gym. And then from that, we reverse engineer the recovery included in that. So you definitely need to have active recovery outside of just working out. And that's everyone across the board, no matter what you're doing.
And when do you have the people coming in who have been working out the hardest, when do you give them the scotch? Is that part of the workout, or is that part of the recovery?
I would say neither. I would say neither. Protein shake, that
Fair
would
enough.
be pretty
Fair
diabolical.
enough.
There you go.
So we're getting in shape in spite of the scotch, not because of it. Is that right?
Exactly. You got to kind of fight the scotch to get in shape.
Dang it.
So here's a good question. Protein shake before the workout or after the workout?
Depends. It definitely depends. So if we're looking specifically for strength and muscle growth, you can do it after the workout. If you're going to do a protein shake before or during the workout, depends on what kind of workout you're doing. So if you're going to do something that's highly cardiometabolic, something that's going to be high intensity interval, having that protein shake before the workout is going to be kind of a waste of time. You're not going to digest or absorb any of that during that bout of exercise, and it may just make you nauseous and have to vomit while you're doing it. Now, if you're going to have that protein shake hours before your workout in terms of fueling yourself up to do the activity, then that's also okay. But it really just depends on what we're looking for specifically.
I didn't hear you talk about pre-workout. That's a good point, Lee. So I know a lot of people have their routine where they do the pre-workout where there's a really high carbohydrate sugar for energy, and then they do the workout and then they do their protein. Is that the best way? And how long before do you do the pre-workout, and how long after you do do the protein?
Once again, that's going to depend on what your pre-workout is. Are you taking one of these pre-made shakes that's going to be high in sugar and caffeine?
Yeah, are they good for you? I mean, they seem like there's a lot of chemicals in there.
By and large, most sold pre-workouts, almost things that are marketed as pre-workouts, are just caffeine and sugar. That's typically what they are. You're going to be 300, 200 plus milligrams of caffeine. They're going to slap some things on there and say they have, some niacin or B vitamins in there to give you that tingle. But they're by and large chemicals of caffeine and sugar.
But caffeine does help performance, right? I mean, it's not necessarily a bad thing.
And so that's what I was going to say, is that caffeine helps performance. And the carbohydrates help with energy as well. But there are healthier ways of getting that as opposed to these marketed pre-workouts.
What are those healthier ways?
If you want to have coffee, by all means, have coffee before your workout, right? Ideally black, no added sugar, etc. In moderation. If you're looking for the carbohydrate piece, we want to have some complex carbohydrate a couple hours before our workout to make sure we're quote unquote carb loading to get ready for that bout of exercise. And this where it comes into like educating clients, educating the population that comes in here, but also being very intentional with everything we're doing, right? If you know your workout is at X time, say it's at 2:00, it means you need to be intentional in what you put in your body leading up to that period of time so that you can have the most efficient, most productive workout at 2:00. And then also being intentional about what you put in your body after you leave the gym, right? Making sure you're hydrating.
Where does Lee's Muffin come in?
I'll say
where does the Lee?
That is the boost. These guns come from that muffin.
Oddly enough, I just found out about that muffin after all these years. So.
I know.
He thought the muffin was my muffin top.
You just rub it on your sides. That's where it's going.
What we're alluding to for people out there is literally every morning I have a cinnamon crunch muffin from a local place here called Offerdals. I don't know if anyone knows who John Offerdahl is. He was a Miami Dolphins football player. Amazing guy. But he makes the greatest cinnamon muffin, and I would say probably for the last...
Yeah, but getting a muffin from a great athlete does not give you the attributes of that great athlete. I just want to put that out there. I don't want anyone to think that that's what we're saying.
But I've had that muffin almost every morning for the last 3 years.
Wow.
Nice. That's a great plug for Offerdahl.
And I would not recommend, people, loading in carbs and nothing else in the morning. It's just, it's my routine and I can't break it. But now Brandon's going to be on me and I know it.
That I am. Now that I know.
So let's circle back again. When we're talking about pre-workout, the first thing I want to say from a medical perspective is caffeine, things like creatine, beta-alanine. What people really do have to know is you really need to be very, very well hydrated if you're going to use those substances. Most of these types of substances are going to dry you out. They're going to make you pee a lot. And you really need that hydration. The other thing, Brandon was talking about how if you did, for example, a protein shake right before you started working out, well, what's the physiology of what's going on there? Well, when you start working out, the blood has to shift away from other organs and shift towards your muscles in order to power your muscles for the energy that you need while you're working out. And so that blood comes away from the digestive tract, and the digestive tract can't do what it's supposed to do. And what you just put in just sits there. And that's why you have a potential of getting nauseated or vomiting. It doesn't really work for you because you're not digesting it. So that's where Brandon was getting into with that. But that brings up another point, Brandon. If I'm going to be training, should I do my cardio first and then my muscle training? Or should I do my muscle training first and then my cardio?
Always strength training before cardio. The cardio is going to slow down your neuromuscular signaling, which will lead you to a higher potential for injury. So always the strength training and then the cardio.
That's great. I didn't know that. That's excellent.
Yeah, and there's another physiologic reason for that as well. The physiologic reason is that you have a certain amount of glucose in your muscles.
It's glycogen, yeah.
And that glucose is necessary for your muscle function. If you do your cardio first, you're going to deplete the glucose from your muscles, and you're not going to have as efficient of a muscle workout. If you do the muscle training first, you'll use up that glucose in the muscles. Then you do your cardio. Your cardio doesn't need that glucose, and so number one, you're going to have more efficient training in terms of your muscle training, but your ability to lose fat with your cardio workout will be more efficient.
By that reasoning, though, Lee, that makes a lot of sense, actually, because it's the same process you go through in fasting. You got to burn off the glycogen first, then you go through gluconeogenesis in your liver, and once you get through that, you start going into ketosis and pulling fats out of your stores. So by that reasoning, if you do that the weightlifting first, and then you do the cardio, you'll be ready to be an efficient fat burning machine.
And there you go. That sounds like it's a prelude to another episode of Vital Discourse. But this has been a fantastic discussion. I think that if we were going to give a Vital Discourse message of the day, it would probably be that you shouldn't be scared to go to someone like Brandon, go to a gym or studio that specializes in strength and conditioning type of training, as opposed to nothing against an LA Fitness and that type of thing, or Orange Theory. But I think if you want a workout that's going to have some longevity to it and really address your needs personally, you go to someone like Brandon and get a real assessment and get a program that works for you. So this has been the Vital Discourse episode on fitness and training. I want to thank Brandon Ward. Amazing discussion. Thank my cohort Ben, and we'll see you next time.
Thanks, y'all.